Well, I'm very excited to be able to do this because those of you who know Gigi know she's a wonderful person and she works with a terrific program called CHAMP that she'll be telling us more about tonight. And Families as Allies has the good fortune of being able to partner with CHAMP. And I just want to tell y'all it's one of the best things ever. I'm a big CHAMP cheerleader. So if you hear Gigi say anything you want to be a part of, I will encourage you right now to jump right in. But I want to tell you a little bit about Gigi. She's a licensed clinical social worker, a master certified health education specialist, and she's the program director for CHAMP that she'll be telling us about. It's operated out of University of Mississippi Medical Center. And before she was in this position, she completed a 2-year postgraduate fellowship with the Mississippi Thrive, which is the same program and project that led to all of us having this coalition and being here tonight. So, she did a lot of developmental assessments for children aged 6 months and under with a multidisciplinary team through that program at the Case Center. And as a clinician, she still provides therapeutic services to families with children ages 2 through 7 who have behavioral health concerns about their children, as well as exposure to trauma events for young children and adolescents. She earned her bachelor's degree in health education from the University of Arkansas in Fayetteville. Go Hogs, and later received a Master of Public Health and a Master of Social Work from the dual degree program at New Mexico State University in Las Cruces. And I think y'all are going to love hearing what Gigi has to say. And I'm so excited you're here, Gigi. I'm going to turn the floor over to you.
Thank you, Joy. I appreciate it. I haven't heard anyone say go hog since I've been here. So thank you. That was a special
Yeah,
treat.
I don't think that gets said too often in
Right.
Mississippi, but
Yes.
I
Thank
wanted
you.
to do it.
I appreciate that. Thank you. Yeah, good evening, everyone. And thank you so much for allowing me this time to speak with you. I do apologize. I'm going to kind of breeze through things a little quickly, but definitely know that I try to answer any questions that I can. And please do feel free to follow up with me afterwards if you have any questions or, like Joy said, any interest at all in knowing more about CHAMP, trying to get involved with CHAMP, promoting CHAMP, anything like that. We absolutely love to partner with individuals and with groups. Callie, do I need to share my presentation? Is that right? Okay. Right. I think, let me see here. Let me get this going. All right. And you all let me know when that comes up. All right. And then let's see here. Gotta get to, Mhm. Let's see, presentation. Well, let me see if that works. Okay. Can you all see full screen now? Is that
Yeah.
right? Okay. All right. Wonderful. Okay. Again, well, like Joy said, again, and like it's been said, I'm the program director, Gigi Holder program director for the CHAMP program that does stand for Child Access to Mental Health and Psychiatry. I can't see the chat right now, but I would love for people to put in there if you've even heard of CHAMP, maybe just a yes or no or anything like that. If this is your first time of hearing about CHAMP, or if you have, and maybe where you've heard about it before, because again, continuous engagement and promotion of the program is like the one of the lifeline of the program, pretty much. But just basically giving an overview of what we do, what this program is meant to do, the purpose of it, and basically just keeping in mind that the goal of this program is to expand mental health care access to all Mississippi youth. And let's see here. Hopefully that changed right there. So yeah, just going over again of what I'll be covering, just giving a background, purpose of the program, a few highlights regarding our growth of the program, and giving a couple of case examples to give an illustration of how CHAMP is utilized or being utilized throughout the community and throughout the state. So again, yeah, child access to mental health and psychiatry, the CHAMP program. I always say, if anything in a nutshell, of just remembering that CHAMP acts as a phone line, a statewide phone line. But this is a service that is primarily for our primary care providers throughout the state. So our doctors, our nurses, like our nurse practitioners, physician assistants, those who are treating those who have concerns for mental health and behavioral health issues that they are seeing in their clinics. And typically that is, since this is the pediatric side, those are for, or this is for individuals age 21 and under. So again, this is provider to provider, so physician to physician, regarding the care of the patient. We do not take on the care of the patient. We don't take referrals or anything like that. I always like to remember our clinical director's way of explaining it, saying this is kind of like your 1-800 dial a psychologist down the hall, or dial a psychiatrist down the hall. If these providers know that all they have to do is pick up the phone and call and schedule a consultation with one of our consultants, they can get that care of the patient to them much faster, rather than having to make a specialty referral, waiting. Then the patient has to wait weeks, months. We all know that there's not enough mental health specialists throughout the state, absolutely not enough psychiatrists throughout the state, those that don't take Medicaid, and just on and on that it goes. So this is a way that this type of a program and this framework is really helping to address that. And I'll get into it a little bit more in a bit, but just knowing that this framework, which is a national framework, these are called Child Psychiatry Access Programs, or CPAP programs, not to be confused with the breathing machine, but that is how we are notated nationally. Again, we do operate just through our normal business hours. So we are Monday through Friday, excluding major holidays, and open 8 to 5 is when those consultations can happen. They can either be scheduled, they can happen in real time, typically when a provider calls and they can schedule that call to be with one of our consultants. Whenever it's convenient for them, the patient does not have to be in clinic with them. It's whenever the provider has that time to discuss that case with the consultant, get that guidance, and then they go back and complete that case or see to that case when convenient for them. And then consults can also be scheduled online via our website as well too. And I'll share that as well a little bit later. So I always like to remove the veil and say, who is CHAMP? Who are we? Because again, we're a phone line, but I think it's always important to notate who is on the other end, or who's behind the scenes of doing the work of the program. So this is just our kind of little family photo, our little Brady Bunch family photo, if you will. We've had a few changes, as we know that happens in the grant world, and different folks kind of move off or their positions change and all of that. However, for the most part, most of our team is pictured here. Again, this is on the pediatric side with our CHAMP program. It's a combination of providers, of intake clinicians. We have sustainability consultants, because again, this is a grant project and we are trying to work towards sustainability. How can we maintain this service throughout the state? Research assistants and other partners throughout the state as well too. So it's a giant wheel, and it only works with all of us on the team doing our part. So that's very, very important right there. So just a few program highlights. Again, as I mentioned, we are the state's CPAP program. Almost every state in the country has a program that's like this. Again, I'll get into that in just a little bit, except for Idaho, but they are, just heard recently that they're jumping on board, so yay. And this is a national framework that actually started up in Massachusetts with their program. Here, we are housed we're out of the psychiatry department here at UMMC. Physically, we're housed at the K Clinic, Center for Advancement of Youth. A few of us are here, but a few of us are kind of scattered in other areas as well too. We have one of our consultants that's located on the coast. Other team members are actually on UMMC campus. We'll have times where we have team meetings. So all of that, we know how all those moving parts go when we're trying to do work collectively, whether it's hybrid, or like in person and all of that. And then with this grant, our Title V organization is and it's funneled through the Mississippi Department of Mental Health. CHAMP was officially launched in 2018. So we've been active for a good few years now through a first round of grant funding that came through from HRSA, so the Health Resources and Services Administration. We're part of that first cohort, and then it just kind of snowballed from there. Initially, we were just starting in the Delta area, just as our catchment area. And then it's kind of, in a way, kind of serendipitous when COVID happened that we were able to go statewide at that time, because again, we are able to do our work, which basically just kind of telehealth anyway, as a phone line, and just getting providers connected to our consultants here. So that didn't really impede our work. It really just kind of spurred it along faster for us to go statewide a bit faster or sooner than we had planned. Because this is a grant funded project, we do have, of course, fund reports that we have to report back to our grant funders, back to HRSA. So they do ask that we register providers in our program. What that means is that we just take their information down and notate. We want to notate who is using this service, who are they, what is their discipline, where are they located throughout the state, and so on and so forth. So as of a little bit earlier in this week, we do have at least almost 230 providers throughout the state registered within our program, and that's a combination of pediatricians, family medicine physicians, nurse practitioners, and so on. We do also say that there's a no wrong door approach with this program, that truly anyone can give a call to CHAMP. It's not like we'll just hang up the phone or anything like that. We do explain what the service is for, but I have had conversations with parents before, foster parents, some wanting just summer camp resources for their child. Whatever the concern is, we will do our best to provide those resources. But again, just also making, just putting out in the forefront that what the service, who it's the primary audience is for. And then as of to date, we have done 1,631 consults. That's primarily consultations between a provider and one of our consultants, maybe regarding medication management for one of their patients, diagnostic evaluation. We get providers that maybe if they're not sure, is this a clear-cut autism that I'm seeing? Is this more, are we dealing with only ADHD? Are we dealing with depression, anxiety? What's just wanting to get more of that picture right there. And so we offer them that guidance as well too. Also encouraging them to use mental health screeners within their practice as well too. We can help them score those screeners if they need that information as well. And then also we have completed our first impact report for our first 5 years of the program. Of course, now that 2025 is complete, we'll be working on that annual report here that will be coming out hopefully in the spring or so. And for anyone on here, we'd love to get a copy to you to let you know of the work that's being done, again, with your state's CPAP program, with your Child Psychiatry Access Program. So services that we offered, again, this is free for providers. We don't bill for these services, and there's no billing that they have to do for these services at all. Again, medication management, diagnostic evaluation, also resource and referral. A lot of times we'll get providers that, again, need therapy resources for their children, for their pediatric patients. So we kind of take that burden off of them or off of their nurses, and we give them that list of resources based on our own kind of ongoing resource directory that we keep on hand. And again, just collecting resources along the way. Again, this is for providers who are seeing patients 21 and under. Again, this is on the pediatric side. I will mention about the perinatal side here in just a bit. But outside of that, we do expand and offer other opportunities to be involved in CHAMP or to gain continuing education opportunities with CHAMP, which is very important. We want to, not only is it that we're providing services and education on the phone with providers, but then also keeping it ongoing so that they can increase their own wheelhouse and their toolbox so that they can continue the care of their patients, and really kind of just get to the point where they call CHAMP maybe just as a saying like, I kind of just need this guidance. I think I know what to do, but I also want this guidance. And then we also have a monthly newsletter that we send out to providers that are registered in our program, and then offer community supports as well too, just through partnerships and other avenues that we can collaborate. I do like to preface that CHAMP is not a crisis line. It's a non-emergent line. There have been times, of course, where crisis situations will come up. We do respond to those as best we can and just reiterate that of what the purpose of this line is. And we direct them towards the appropriate crisis resources if that's needed. So how does CHAMP work? Again, I always say, like, I'll explain it, and you know how sometimes we're like, okay, great, but yet how does it work? What's the magic behind it? And truly, I just love to tell providers that, again, just pick up the phone and we'll do the rest. So basically, picking up the phone, there's our phone number right there. They just give a call. Well, whoever the intake clinician, like myself or one of the other behavioral health clinicians, they will answer the phone. However much time that the provider can spend, maybe a few minutes. We know that they're very busy. We would just want to get some basic information about the patient who they're calling about, what the concern is, so that we know the appropriate consultant to funnel it to. And then that consultant will call the provider back based on the time or time of day of the week that they've indicated that is best for them. So again, these can be same day, or these can be scheduled as well too. And again, if not for the phone line, they're also able to go onto our website, champms.org, and schedule a consultation that way as well too. And it's interesting, when once they figure out what works best for them, whether the call line or the online form, they stick with that. I have a provider that once she learned about the online form, she never calls anymore, but she always uses the online form, and I love it. Um, Again, I do always like to preface and just set the stage that this is a national framework. As I mentioned, that with the Massachusetts program, the MCPAP program that started way back in 2004. And just from there, it's really continued on to where a lot of the state programs now are grant funded. Some have achieved sustainability through their states. Some are using funding from foundations. We're all just kind of keeping our eyes open for different opportunities of where we can receive that funding so that we can keep this work going. But I am very, very proud to say that pretty much every state has a program that's like this. So that's why I always like to show that map right there. And then, yeah, the just continuous engagement and sustainability is a huge, huge focus of the program. If you'd like to know more about the national network and knowing what some of the other programs are in neighboring states, other states, the national network website is nncpap.org. So National Network of Child Psychiatry Access Programs. I definitely encourage you to check that out, and just to learn more about the different programs that are happening in other states. And then, as I mentioned, we do have a Champ for Moms, so our perinatal side of our project that actually started. So we have a statewide perinatal psychiatry access program, or PPAP. Those are up and coming as well too. Not every state has a program that's like that. Right now, I want to say it's less than 15 states that have a CPAP. Those were initiated, or at least ours, our Champ for Moms was started through a grant in 2023. And then we received HRSA funding in 2024. And so now it's on a 5-year grant cycle where they as well are increasing the awareness of these programs for providers who see perinatal and postnatal individuals with concerns for mental health challenges. I would just say some highlights of this program right here. And again, there's our family Brady Bunch photo right here too. And we do share some shared staff as well too, that they host a wonderful yearly summit, educational wise. And what we're trying to do is train more mental health specialists in the area of perinatal, maternal mental health, and being able to support that more. There's an Echo series that we host as well too, which is a web-based, a 1-hour web-based series that we host at various times throughout the year. And the focus of the sessions may vary. Maybe it's on postpartum depression. It might be on bipolar concerns or bipolar disorder. Same with our pediatric side as well too. We also host an Echo series as well too. And we all use the same phone line so that there's no confusion right there. You give a call, and whoever the provider is, they can still just put in a CHAMP consult request in the same way. So just real quick, a couple of case examples here, and these are ones that we just kind of keep on hand of real providers who have actually used this service before. These were actually from our newsletter way back in the day, but we still just keep these stories on hand, and I do just like to share them. So this is Dr. Robert Justice. He is a pediatrician in Meridian. He gave a call to CHAMP regarding a concern for his 6-year-old male patient who needed an alternative, the ADHD medication that he was currently on at the time. It was not giving the proper results, and then it also was resulting in weight loss. So in order to get that guidance, he gave a call to the CHAMP program. He spoke to our child psychiatrist, Dr. Philip Meredith, to get that guidance on what some other options might have been at that time. And then also at that time, we had one of our child psychiatry fellows on the team as well too on that call, that's another thing that we try to do is do the training for the psychiatry residents so that they know about this framework, but then also for pediatric residents so that they know about this framework before they get off until, kind of go out into the wide open world and they know about this framework as well too. So he is a provider that has used our service and continues to use our services to this day. And then we have Miss Chanel Barnes, a pediatric nurse practitioner in Columbus. She's given a call several times. She's reached out to CHAMP before. There was a time where she gave a call regarding a 14-year-old female patient with concerns for depression and unspecified anxiety symptoms, and she was being treated on Prozac at that time. She wasn't receiving therapy, so Ms. Barnes gave a call and wanted to know what the appropriate medication regimen might be when something like Prozac has failed and it's not addressing the depression symptoms. And then also what are some referral options in the community when it comes to therapy resources. So we were able to supply that to her, both Dr. Philip Meredith, our child psychiatrist, able to respond to that. And then also we were able to get her some resources for her to pass along to the patient's family for them to reach out and see if what would be a good fit based on their needs right there. That's actually all right there that I have, just giving that example with CHAMP. Please let me know if you have any questions. And the biggest thing that I could ask if there's an action request is to please, if anyone that you know in your networks, pass this information along about CHAMP, because that's really how we keep the word about this program going, is word of mouth, and so that individuals continue to use this service. So thank you all so much, and